Neet PG 2025 GT Review Class 2. So, mode of transmission of cryptococcus is inhalation of yeast cells from the pigeon droppings. Then the culture which is used to demonstrate the O2 requirements of bacterium is the stab culture. Then a question will contain positive lactulose breath, which is a clincher to the small intestinal bacterial overgrowth. Then VSD, it is found in actually diabetic infant of diabetic mother. These congenital anomalies, VSD, caudal regression syndrome, sacral agenesis. Then rooting reflex is fully developed by 34 to 36 weeks of gestation. NF1 gene is found on 17q11 chromosome. In esophageal perforation, barium sulfate is contraindicated and iohexol is used, which is non-ionic water-soluble contrast. In valproate toxicity, L-carnitine is used. Then major criteria and Duke's criteria for infective endocarditis is first is the new onset murmur and or mitral regurgitation, you can say. Then next is the single positive blood culture for Coxiella burnetii. This is very specific organism, Coxiella burnetii. Then treatment of acute promyelocytic leukemia or AML M3 is tretinoin, all tretinoin. Then in mania, neurotransmitter involved are serotonin, noradrenaline, and dopamine. Then in body packing with the drugs, for example, in the smugglers, we do the whole bowel irrigation. Then calculating the bleaching powder used in the Horrocks apparatus, n into 2 for 455 liters of water, n into 2 gram is used. N is the first cup. There are various cups, 1 2 3 4 in the Horrocks apparatus. So for example, the second cup shows the distinct blue color. It is the first cup in which the blue color is present. It is the second cup. Then 2 into 2 is equals to 4 gram is required of bleaching powder for the 455 liter of water disinfection. Triangle of doom. Boundaries are medially by vas difference, laterally by gonadal vessels. Apex it has the deep inguinal ring. In the vials with cytotoxic drugs, they are disposed of in the yellow bin and plasma pyrolysis is done. Digoxin toxicity is aggregated by hypokalemia, hypomagnesemia, hypercalcemia, and hypernatremia. In case of urethral stricture, do a retrograde ureterogram. Then blunt trauma to the chest, it can cause the cardiac tamponade in which backstride will be seen, muffled heart sounds, jugular venous distension, and hypotension. Then RDA principle is not applicable for the energy. Then facial nerve palsy, it can cause exposure keratopathy. And then Glanzmann thrombasthenia, in it there is the GP1 2B3A defect, and there is it is differs from other platelet disorder by platelet aggregation test is abnormal. Then is the I-125 albumin is used to measure the plasma volume. Then inulin is used for ECF measurement, Evans blue for the plasma volume. In lithium toxicity, it can occur with the concomitant use of diuretics such as thiazides, ACE inhibitor, ARBs, indomethacin, doxycycline, and furosemide. Then analgesic nephropathy. Analgesic nephropathy, we give the phenacetin, aspirin, and the caffeine. In fibromyalgia, what will be the presentation in the question? Tender bony prominence, increased pain sensitivity. Then inverse stretch reflex or Golgi tendon reflex is the disynaptic reflex, and receptors are arranged in series. It is stimulated by passive as well as active stretch. Then adductor pollicis is supplied by ulnar nerve, abductor pollicis by the median nerve. This adductor pollicis muscle is also used in anesthesia for measuring the neuromuscular blockade. Then rugoscopy, we study the rugae of the hard palate. Then in glomus tumor, in the middle ear, then we just use the caesial speculum. It will pulsate vigorously and then blanches on changes in the pressure with the caesial speculum. Then in late phase of pollen allergy, it is mediated by eosinophils. Then Dehlen-Fuch nodules. Dehlen-Fuch nodules are seen in sympathetic ophthalmitis, which is a type 4 hypersensitivity reaction. Then this is very important. Boer committee gave 3 million plan. Jungle Wala committee, it gave integration of health services. Kartar Singh committee on multipurpose health workers. Shri Vastav committee village health guide scheme. Then this is the egg of Mansonia, which is shown. Then Tauton giant cell xanthoma, achondroplasia, macrocephaly seen, and the Allen-Meyer-Flass deformity. Then urge to move. Question will contain the patient is having the urge to move and restlessness after haloperidol. Then it is akathisia, which treatment is the lorazepam and propranolol. Then myotonic dystrophy, there will be hatchet faces, weakness of the distal extreme muscles of distal extremities, means hand muscles are affected, and hatchet faces are seen, frontal balding is seen, CTG repeats are seen. So that was all for this second class. This was the second class, and we have discussed almost 150 questions in first and second class. We have almost discussed 150 questions of GTs in this 14 to 15 minutes class. Okay, thank you. Subscribe to our YouTube channel for the class 3.